city and county websites. And we do encourage you to join us. We have press conference every day at 1 p.m. And you can join us for the latest information on our community's response to the COVID-19 emergency. As we begin today, I want to mention we will have a representative next week to join us for our press conference, but I did want to mention the Southwest Georgia Council on Aging. We've had some concerns to come in and making resources available to our citizens, and the Council on Aging, the purpose of this group is they plan and provide, develop, and coordinate services for all people 60 years of age and older in a 14-county region covering 6,000 square miles in the Southwest Georgia area. So for services from SWGA, please call 1-800-282-6612. That's 1-800-282-6612. That is the Southwest Georgia Council on Aging. And so I'm very glad that that resource, the awareness is there for this resource, and we'll be looking forward to having them be a part of our press conference one day next week. Today, we're going to begin, like we begin all of our press conferences, we're going to begin with comments from our mayor, Mayor Bo Durrell. Please come up.
Thank you. Good afternoon. I would like to provide some clarification on the testing which has been performed in recent weeks and the results of those tests. I think there's a great deal of misunderstanding out in the community. Phoebe Putney has collected 1,914 samples. 217 people have tested positive, and 255 people have tested negative. This means from the hospital, we have 1,442 patients who are awaiting test results. We also know the results of 20 samples collected at Albany Internal Medicine, and that 18 samples collected by the Department of Public Health were positive. Albany Internal Medicine is awaiting the results from 25 tests, and the Department of Public Health is awaiting on the results from several hundred samples. The results we are getting are from samples collected 5 to 10 days ago. We have advised the public. The few labs in this country which have the capacity to test samples for this virus are overwhelmed, and therefore the response time is lagging. Hopefully, and we can hear from Dr. Black earlier, Phoebe Putney will be in a position to do in-house testing. We'll know the results within a couple of hours, possibly next week. But until that time, we are relying on samples collected, the results from samples collected 5 to 10 days ago. The number of infected people, as I have previously stated, is almost certainly in excess of 500. Many citizens are requesting that, all capital letters, everything be closed. I want to emphasize that the measures that have been taken were implemented pursuant to advice from healthcare professionals. No one from the CDC, no one from the Georgia Department of Public Health, and to my knowledge, no local professional, medical professional, has advised us to take any more stringent measures than we have taken. This is not a political decision. I can assure you that Chairman Kohelas, your local governments, and myself are prepared to make difficult decisions. However, this effort to insist that, all capital, everything be closed is predicated upon misinformation. We can and will curb the spread of the virus by following the recommendations you have heard repeatedly in the last 2 weeks. Maintain social distancing, wash your hands thoroughly with soap and water repeatedly throughout the day, and remain in your homes unless absolutely necessary. Following these precautions has proven to be successful in reducing the number of infections. Healthcare professionals must travel to and from hospitals and doctors' offices to provide the services they have so admirably and courageously rendered in the last few weeks. Grocery stores must remain open so that we have access to food to feed our families as we combat this invisible enemy. We must have police officers patrolling our streets, and firemen must be prepared to respond at a moment's notice. The city provides electricity, gas, and water to its citizens and must continue to collect garbage, run our public transit system, and maintain our infrastructure. We ask you to continue to shelter in place. We have indeed received complaints of some citizens and businesses which are not in compliance with the executive order. Please be assured, local law enforcement agencies will be responding to reports of these violations. The city and county will continue to work with the governor's office and other officials at the state level and with the federal government to effectively curb the spread of the virus. I implore you to follow the guidelines, shelter in place, and pray for the nurses, physicians, law enforcement officers, and others who are and will remain on the front line until this epidemic has passed. Thank you.
Thank you, Mr. Mayor. Now for some comments, Chairman Christopher Cohelas.
Thank you, Chief. Thank you, Mayor. Currently, we face many funerals that are taking place in our community. We've lost brothers, sisters, mothers, fathers. It is a sad occasion. Our community is grieving and also bracing to continue to deal with the impact of the coronavirus. I want to first begin by saying thank you to all of our citizens. The large majority of our citizens are following the rules. We are actually leading by example for this region, this portion of the state, and this state. We have been at the forefront of this crisis and have been leading through very disciplined action, through progressive and swift action that have been taken by leaders within this community and by the citizens who are here. I recognize that we have many funerals that are taking place at this time. I think we have about 16 that are currently in different stages of process. I would continue to please remember or ask our citizens to remember that we do need to be diligent even during times of grief. We need to only have 10 people or less at graveside funerals. That is a very important factor. We know how this virus was initially spread within our community through 2 funerals where it infected a large number of people. While I recognize that this is a time of grief and we all appreciate the opportunity to connect with each other, during a time of grief, we have to continue to be disciplined, and we have to continue to lead so that other areas of the state, our surrounding counties, surrounding cities, other communities understand how you have to respond in order to control this. With that being said, I want to turn to another point. I want to encourage our citizens to be very disciplined in what they accept as information that is true and correct. Be diligent in where you find your sources of information. I've received a large number of questions relative to some comments that were made by Governor Kemp at his town hall meeting last night relative to Albany and where it is and where it was when he has communicated with our community. Let me be very clear. Let me be crystal clear. No one has refused any help from the governor's office. Quite the opposite. Myself and others have been in direct contact every single day with the governor himself, his team, and his leaders. We have done nothing but ask for help and accept tremendous amounts of help here in this community. And I would challenge those that would say otherwise to look at the resources we have here in this community compared to the many other communities across the state. We have an isolation facility. We're receiving supply chain logistical support from GEMA. We have an epidemiology team from the Department of Public Health. We have a team from the CDC. We have supplies that have been routed here, an additional testing facility, and we now have staffing coming to Phoebe Putney Memorial Hospital as it continues to service the needs of this community. I ask you, does that sound as if this is a community that has turned down help? No, that's not the truth. The truth is that the governor's comments related to whether or not we needed help getting an order for shelter in place in effect. And in fact, we didn't, because we had already drafted one. And we adopted it that day, and it's more stringent than just about anyone else's in the entire state of Georgia. We were if we were not the first, we were one of the first to in fact declare a state of emergency, and one of the first to actually order shelter in place. Our actions are being reviewed by many, many other communities. This morning, I got called by the New York Times. We were receiving calls from Los Angeles, California, other communities around the state that are literally asking us, how do we respond in such a way so that we can actually do the things that we need to in order to be safe? I remind all of our citizens, while we may have been the first to experience a large outbreak, that doesn't define our progress. How we have managed it thus far has been very effective and will continue to require the cooperation, discipline, and leadership of not just our leaders, but of our citizens. And I'm proud to be a citizen of Dougherty County. I'm proud to be the Dougherty County Commission Chairman, because at this time, just as we have in every other disaster that we have seen, we are doing the right thing. Thank you.
Thank you, Mr. Chairman. We also have joining us, and we're very, very happy to have you here with us today, the Lee County Chairman, Billy Mathis. We'd like to ask Mr. Mathis to come forward for some comments, please.
Again, thank you all for letting Lee County have a voice to get the word out. My comments will be brief. What I'd really like to address today, I'd like to echo what Mr. Kahilas and Mr. Dura have just said. I have gotten, and I'm sure they have, any number of suggestions about what we should and shouldn't be doing during this time of crisis. Both of our communities have enacted very, very stringent rules for businesses and our citizens. We read early on and did as much research as we could to try to figure out what we should be doing as a community. And the CDC tells us that there are different things that large cities should be doing. There are different things that communities with less dense populations should be doing. We have a population of about 30,000 people in Lee County. It is my understanding that the CDC guidelines say for communities less than 35,000 people, we should be doing exactly what we're doing. We are having people stay at home as much as possible. We've closed some non-essential businesses, but yet we have to have people go to grocery stores. Now, again, we get many, many suggestions about what we should and shouldn't do. We made a decision in Lee County, for example, to allow people to go to the grocery stores whenever they see fit during normal business hours. We did that because the experts tell us that it's worse to have folks standing in lines at grocery stores than to just have folks go in an orderly fashion to the grocery store during the day. That's working. It's working for us. In a county like ours, where we don't have as dense a population, you can go outdoors, you can go for a jog, you can go for a walk, you can do those things, as opposed to, say, in Atlanta. I got a call today from someone in Atlanta and asked us what we were doing, and we talked about the differences in living where we live versus living in Atlanta. If you walk out your door in Atlanta, you will likely run into somebody right when you walk out the door. It's a very different place. And the reason I say all that is because this is a tough time for the citizens. Everybody seems to have an opinion as to what we should be doing or we shouldn't be doing. I had 3 or 4 emails just before I got here suggesting that Lee County and Dougherty County and the city of Albany just close everything down. As Chairman Kahilas says, nobody has suggested that we do that, but there are a lot of people who feel like we should. I want the citizens to understand that we're doing everything that we can do to digest all of the information that we have gotten as leaders of the community to do what we should be doing to curb the virus. Now, a couple of other things that I'd like to mention, just as far as Lee County is concerned. We don't have the numbers today, I don't think, the latest numbers. Yesterday, there were 30 confirmed cases in Lee County and 3 fatalities. There are several confirmed cases in the Lee County State Prison. I've had a lot of calls from people asking, what are you going to do about the prison? People should understand, and I want them to understand, that the Lee County Board of Commissioners has no control over the Lee County Prison. That's a state facility, and any questions or comments regarding the state prison should be directed to the state of Georgia. Another thing, just as a housekeeping matter, we have had a tremendous number of phone calls to our 911 system with non-emergency questions. I would urge the public, if you have a question, if you have a comment that's not of an emergent nature, please, please do not call 911. Don't call about the restrictions, don't call about the rules, don't call with suggestions. If you have an emergency, don't hesitate to call 911, but please use it for emergencies only. We'd ask that, one other quick thing, the call that I had earlier today with someone at the state asked, how are things going down there? And I told that person that it was my feeling from my observations in the community that the people, the citizens, were now doing, for the most part, what they should be doing. People understand the seriousness of the situation, and people are now doing most all of those things that we've asked them to do. Limit your trips to the grocery store, social distance, wash your hands, all those things that for the most part people are now doing those things. We would urge you to continue doing those things as best you can, and please understand, we like to hear your suggestions, but we all are trying to do the very best that we can to follow the guidelines that we've received from the health officials. Thank you.
Thank you, Chairman Mathis. Next, I'd like to bring up now for a report from Phoebe Putnam Memorial Hospital, Dr. James Black, who is the chairman of the emergency department. Dr. Black.
Thank you. I will try not to restate a lot of the very pertinent comments that have been made before me. Our community leaders have done a very good job of outlining the things that they're doing in accordance with state and federal guidelines, and much at the hospital we're doing the same thing. A lot of our recommendations for treatment of the disease, treatment of patients, notifications come from the state and federal level. So we're all, number one, very aware of the restrictions and things that are being placed on us, but we also want to be as nimble as we can in order to react to those changes. And I think that, as was stated before, by and large, the community has done a very good job in assisting us with those. Our numbers for today, and I want to be, again, we do give different numbers based on what we're telling about, and these numbers represent Phoebe Health Systems. That includes all of our hospital and our office-based practices, as well as our drive-up clinic. Totally, to date, we have 265 positives, 374 negatives. We have pending 1,559 tests, and we have a total of 18 deaths. And again, that's across the health system. And those are people that have come into contact with our hospital and those numbers. Now, there may be others in the community that may be attributed to the number, but you'll get different numbers, again, based on who's reporting their numbers. So I want to make sure we make that clear. Also, Mayor Doro mentioned the possibility of shortening the time and the possibility of bringing some of that testing in-house. We've been exploring that option, various options for the past several weeks. We have to, of course, like everything else, make sure it's approved by various organizations, including the FDA, but we think we're very close to being able to provide that service in-house with the hopes that we'll be able to shorten the amount of time from testing to results. Certainly, if we can get it less than a day and in a couple of hours, that'll help a lot of different things. But I do want to stress upon you, again, the majority of people that even have a positive test have little to no symptoms. Some may need to seek help, and fewer still may need to be put in the emergency department, come to the emergency department and may be admitted. So I want to tell you that the vast number of people that are affected will have little to no symptoms. I'm not trying to discourage anyone. If you'd like additional information, please use our hotline. It's 312-1919 or 312-1919. You'll be able to speak to a medical personnel. They will screen you and let you know whether or not it's prudent for you to get testing. I'd also like to echo a couple other comments that are made. I've been getting questions, well, we're stuck inside the house, we don't know what to do. Shelter in place and staying at home does not necessarily mean being locked in the closet. A couple of things you can do are things we all promised we're going to do every spring. You can go outside and work in the yards. You can still safely distance yourself if one person is mowing the lawn and one person is edging and one person is clipping hedges and one is raking. We all promise to start exercising every year. Well, now's the time. Get out and walk in the neighborhood. I would normally tell you to go up and meet your neighbors. Don't want you to do that right now, but wave from the street. Make sure that you have your neighbors' phone numbers. When I grew up, we all knew all each other's phone numbers. Get out and meet your neighbors. Wave them from the street. I also want you to take a little bit of time and write to some of our family who may be in service that are deployed and would like to be spending time with the family and cannot. And last but not least, pick up the phone. Call your mom and your dad and your other family members and check on them and let them know you're thinking about them. We have a little bit of extra time. Let's use it wisely. Let's exercise. We're going to follow the advice of our civic and health leaders, and we're going to get through this. Thank you again.
Thank you, Dr. Black. Michael Fowler is the Dougherty County coroner. I'd like to ask Mr. Fowler to come up for some comments. Mr. Fowler.
Thank you, sir. Good evening. I want to go with a few other numbers that we have, as Dr. Black have mentioned just then. Those are the numbers from Phoebe, surrounding Phoebe Hospital. The total number of positive residents in Dougherty County is 13. We have 13 deaths that live in Dougherty County. We have 14 that's still pending. We're waiting on those test results. So we have a total of 27 individuals that we are looking to see was positive or not. So really 13 positive, 14 pending the test. And I want to say just one thing to you. This death is real. You know, the other day I mentioned we had 6, and overnight it looked like the individuals just start falling. So I'm saying it's no one race, whether you have faith in God or whether you go to church or don't go to church. Looking at the individuals that died, it's all from the east side, the south side, the west side. It's all over Albany. There's no one location. And then some of the ones that died did not even attend the funeral. So it's not just the one that attended the funeral, the one that went out from the funeral and other individuals was affected about it. So I know that many of you desire to test. My office is steady getting phone calls every day trying to find out about the loved one that passed, what the results. So I need to know what I need to do. I need to know I got kids, do they need to be tested? And I feel the sympathy and I love for you to get the answer as quick as possible. But like I said, things are so backed up right now. So we're waiting on 14 more, and there'll be 14 more families that are going to affect. And another thing, I want you to think about it. Many funeral homes was using limousines. In Dougherty County, we decided not to use limousine. The reason I'm saying, when you put 8 individuals in a car, 3 in the front middle seat, 3 in the back seat, and 2 in the front. If one person is infected in that car, it can cause everyone in there to be exposed. You are not 6 feet apart in the car when you send 3 on the seat. So if one person can affect the whole car, and then once that funeral leaves that and go to another funeral, that car go to another funeral, you can affect another 7 more individuals. So we're trying to, the funeral homes, so family members are calling why we can't use the limousine. So the funeral homes want me to put out there that they're not using the limousines because that virus can spread from an enclosed-in car with that many people in the car. Again, like we said, we had 13 positive, 14 pending, and a total of 27. Thank you.
Thank you, Mr. Fowler. for your comments and update. This is indeed a tough time for many people in our community in dealing with not being able to go to work or being in the house, as Dr. Black mentioned. We're very pleased today to have to join us at our press conference today, representative from Aspire here to discuss the mental health resources available in our community. And I'd like to ask Dana Glass to come forward for some comments. Ms. Glass.
Good afternoon. My name is Dana Glass. I'm a licensed clinical social worker, and I am the CEO for Aspire Behavioral Health and Developmental Disabilities. Aspire is your safety net provider for behavioral health, addictive disease, and developmental disabilities here in Albany. We also serve the surrounding 7 counties and communities. We take that responsibility as your safety net provider very seriously and have done everything within our power to stay as operational as we can within a safe manner. At this point, the only services that we have stopped providing are any services that take place in a group setting. We are continuing to provide services as safely as we can in all of our outpatient clinics, and these services remain available through several different modalities, including office-based, telemental health services, and community direct service provision. To say that we're in a difficult time right now would be to put it very, very mildly. Every day we are faced with new information about the risk and the spread, and that information can easily become overwhelming to us as human beings. You know, as human beings, we really desire and want certainty in our lives. We're hardwired to want to know what's happening, and when things begin to feel threatening to us, it's very normal to feel stressed, to feel anxious, maybe even some depression in relationship to that. That system that programs us to want to know what happens is a protective factor. But as we endure it over a period of time, it can begin to wreak havoc on our overall health and well-being. You know, a large part of anxiety is driven by a sense of what we want to control and we're not able to control. And as we all worry about this virus, that's very much something that we have limited control over. We may feel helpless. We may begin to worry what's going to happen in the future and how to even manage our stress. And so as we go through this period of time, it would be very easy for our mental health to suffer. We don't always even recognize that that's happening. You might begin to notice that you feel more on edge than usual. You feel angry, you might feel helpless, you might feel sad, you might feel something very similar to grief. All of our lives are changing, and when that changes, that's a loss, and that's a very real and valid feeling. You might feel very frustrated with other people, including your friends and family, or you might want to completely avoid what's happening. For those of us that already struggle with overall mental wellness, you know, there might be an increase in symptoms or needs. What's important to remember, though, is that when we're talking about social distancing, what we're really asking people to do is physically distance. Those social connections are more important than ever, and we're fortunate to live in a world where we can stay connected through various technologies. We can call, we can text. There's a lot of electronic visual options like FaceTime, like Zoom meetings that will allow you to see another human being face to face and still be able to maintain that connection while you're in a safe environment and you're not being exposed or exposing others. It's very important that we figure out ways to care for ourselves during this time. It's going to be a little bit of a long haul for us, and part of what we can do is begin to really understand what we are in control of. We can follow all of the direction of this great team. I actually live in Blakely, and I even reached out to our local government to say, hey, let's act aggressively like we're doing here in Dougherty County, so I do appreciate y'all's efforts. You know, things like sticking to your daily routine is very important. That's something that you can be in control of, but regular sleep patterns, eating patterns, waking patterns all contribute to your overall health and well-being. We previously heard our doctor talk about exercise. Exercise is one of the top treatments for anxiety and depression, yet it's one of the most underutilized. Now, that's going to look very different today. It might be as simple as a walk around your neighborhood. But again, there's a lot of available options online. Maybe you try something new. YouTube has several workouts that are available. You can download different workouts on different applications. Yoga is an excellent way that doesn't require equipment, doesn't even require any fancy outfits to practice yoga, but helps reduce stress and anxiety. Another challenge to us is going to be really staying in the present. It's really easy to worry about what's going to happen next week, tomorrow, even later today. And when we find ourselves worrying about things that have not happened yet, it's going to be really important to bring ourselves back to the moment that we're in. You can use your senses to bring that back. What are you seeing? What are you smelling? What are you hearing? What do you taste? And really focusing on what is happening in the moment that you're in. These types of things help us bring back a sense of control. And of course, you want to stay connected and reach out if you need additional support, talking to your friends and family about what you're feeling. Many of our church congregations have gone to online services. I watched 2 services Sunday from my kitchen. If you feel particularly anxious or struggling with your mental health, it's absolutely okay to reach out to a mental health professional. You don't have to be alone during this time with your worry. It can be very comforting just to reach out with somebody that is trained to help. If you're struggling or in crisis, the Aspire's Behavioral Health Crisis Center is 24/7 walk-in access to care. It's located on 601 West 11th Avenue. The Department of Behavioral Health and Developmental Disabilities also has the Georgia Crisis Access Line, which is manned 24/7 by fully licensed clinicians who can direct you to your local resources. That number is 1-800-715-4225. Above all else, it's important to remember you are not alone. We are built to do hard things. We have proved that over the last couple of weeks and will continue to prove that. We're in this together and help is absolutely available.
Thank you, Ms. Glass, for your comments and for being here today. We're at the point now that we will open up for questions that anyone has of any of our speakers today. We would only ask that you step up to the microphones on either side to ask your question, and we will bring the respondent up to the mic to provide a response.
I'll start out by asking, we know that Dougherty County has such a high number of cases, and is there any reason why the city hasn't made the decision to put a curfew in place?
I'd like to ask the mayor to come up, and then followed by the chair if you'd like to make some comments as well. Mr. Mayor?
The question again? Yes, ma'am.
Is there a reason why a curfew has not been in place for the city of Albany?
Well, again, I understand there's a group out there that says we need a curfew in place. Just like today, I tried to address these folks. You said we need to close the city down. But law enforcement is telling us that the streets are pretty quiet. And I assume people are calling in and seeing folks, but that's not what we're hearing from the police department and the sheriff's department. We're receiving scattered reports of gatherings, and police officers respond, and we're finding that most of those people disperse. So the compelling argument about the curfew is just not there. And I also think that some people are calling for a curfew, just want to see more aggressive action. And if we were getting a request from law enforcement, or if we thought there was some compelling medical reason, public health reason to implement a curfew, we would. Thank you.
In many ways, we already have a curfew in place, and what we have in Dougherty County is one of the most restrictive set of regulations that's in the entire state. When you have a curfew, you put a curfew in place, you have to manage it in one of two ways. Either you say no one can ever leave their home, which means that everybody that works in an essential business or has an essential task that they have to carry out, then they can't even go to their job. They can't go to P&G, they can't go to Miller Coors, they can't go work at the hospital. Certainly we can't order the people that are the healthcare workers to stay at home and not go to work. What we have done is this. We've said, these are the essential services. 24 hours a day, your travel can only be for purposes of going to an essential function or an essential business. Other than that, that's it. So having a curfew in place literally doesn't achieve anything more than what we have, because we have these restrictions that are in place 7 days a week, 24 hours a day, every single day. Additionally, we know from looking at what other counties have done, counties have actually utilized curfews as a step up or a step below going to the level of restriction that we are at. Where we're at right now is actually more restrictive than a curfew. And so, because it's in place for 24 hours a day. Now, if need be, and our law enforcement officers say that that will be helpful in us being able to police this, then certainly that's something that we will reconsider. But right now, no one's supposed to be on the road at any time except for purposes of what is approved. And we have law enforcement. A lot of people are asking about enforcement. We have law enforcement that are going out to businesses that have been non-compliant. They're spot checking them. They're shutting them down. We do have law enforcement that are literally enforcing the order every single day. But overall, we do have a lot of citizens that are doing the right thing. And we would also continue to call upon our partners that are the grocery stores, the major food retailers. Please do try and limit the occupancy in your store. Make sure that people have access to sanitizing wipes as well. Thank you.
Additional questions?
I also wanted to ask, has there been any conversations with anyone from the Center for Disease Control about them bringing a team down here?
Please restate your question.
Have there been any conversations with the CDC about them bringing a team down here to help mandate and control the viruses?
Mr. Chairman. And also the mayor as well can comment as well.
Yesterday, we literally had a phone conference with two members of the CDC who joined our task force call. One of the things, had that, 2 days ago, there is a team here. They are working with our healthcare providers and with our community. They're also assessing the situation at Pruitt Health. I also understand that we're going to have some additional information relative to that nursing home later on to report, which is a positive development of us receiving additional resources from the state. One of the things that I have requested through the Department of Public Health is whether or not the CDC can actually do modeling that is specific for our region of the state. I don't know whether or not we'll be able to get that information, but it certainly is being requested.
If I could just say, the two representatives from the CDC who are here mentioned that they have counseled the hospital on best practices to avoid what they call health spreading, which refers to patient-to-patient infection, or worse yet, patient to healthcare provider infection. And a major concern they expressed was the incident at Pruitt Health. I think 2 patients have died. Is that correct, Mr. Fowler? And the potential in what they call congested living, an assisted living facility or nursing home facility. And they are counseling not only the people at Pruitt Health, but other nursing home facilities as well. And I do want to say this, that the CDC was here. One thing they're doing is what they call contact tracing. And for our purposes, it's really not going to be a benefit to us, but it's really more like a forensic investigation. And what they're doing is they're following the infection pattern so that the virus can be combated elsewhere. And thank you.
I also wanted to ask, now that we've been receiving word that first responders are testing positive for COVID-19, are there any extra protocols that are being put in place to ensure their safety?
Well, I think the main premise, and I would certainly give Mr. Allen an opportunity to come up and talk about some of the, I'll bring Sam Allen, who's the director of Dougherty County EMS, for some comments, address that question. Mr. Allen.
Thank you, Chief.
As far as emergency medical service in Dougherty County, all paramedics are wearing N95 masks on every call. They are wearing eye protection. They're wearing gloves. We have Tyvek suits available. When the paramedics go to the call, if depending on the severity of the call, one of them goes in first, the other one suits up and then goes in. First one comes out, resuits up at that point. So if it's a critical call, we go ahead and establish the contact, but we're also following CDC guidelines. Commissioner Mathis also wanted me to mention that Lee County's emergency service is also following the same procedure and protocol. We're following everything through the CDC guidelines. The ambulances are decontaminated after every call. We're making sure that all the equipment is safe and secure for the patient, but we're also making sure that the information and integrity of the crew, that safety is there. We're limiting how many people can ride. If it's a minor, the adult will ride in the back. Other than that, we're not taking anybody to the hospital. The front of the truck is secured off, and that's for the crew members, for their safety. We are also sanitizing the machines at random going through each unit. We're making sure that those trucks have the most sanitized area that we can provide for the medics. So we're monitoring their temperatures daily. We're also monitoring how they're feeling, how they're progressing, along with the call volume. So we are very close in tune with our staff to make sure that they're well protected.
I also wanted to ask if anyone from the school board is here. The days that kids have been out of school, are they going to be able to make these days up? Are there any plans in the works of the days that have been missed?
We have the school superintendent here, Mr. Ken Dyer. Mr. Dyer.
Hello. We want to clarify that although we're not having in-person classes, we are doing distance learning. We provide instructional packets for those students that don't have access to internet, and those students that have access to internet, they're learning online and engaged with their teachers every day. Just yesterday, we completed our distribution of Chromebooks and hotspots for those high school seniors who don't have access to internet access at home, making sure we keep them on track for graduation. We'll start Monday with our dual enrollment students who are not seniors, and then we'll finish our high school deployment next week, and then we'll start with middle school after that. So we're still engaged in learning, just at home and not at school.
Additional questions? Why don't we'll ask the mayor to come up first, and then we'll hear from the chairman, okay? Mr. Mayor?
Thank you. One disagreement Chairman Quillis and I have had, the executive order that was originally drafted, we agreed to follow the executive order that was put in place in Athens. And throughout the day, there were some people, it was being circulated, and there was a provision included that said, there was talking about exempted businesses, and they put in a provision that said any other business can stay open as long as you maintain social distancing. And I just was I was not going to sign the executive order with that change because effectively it had no teeth. It was not aggressive enough. And on reflection, the chairman concurred with my opinion, and that is the executive order that was signed. It is difficult. I have stood up here before and said, I know people that own bars and nightclubs and restaurants, and I know the people who work there. I'm getting calls every day, and it is difficult when people who you consider your friends are explaining to you the economic hardship that they are experiencing and the economic hardship that their employees will be experiencing in the coming weeks. So again, but to bring all this together, I want to say that the measures we have taken have been pursuant to the advice of healthcare professionals. These are not political decisions, and we will continue to follow the advice. If somebody from the CDC said, you need to take more aggressive measures, if the local healthcare community would tell us that, if the Georgia Department of Health, but that is not any advice we're getting. So we are making difficult decisions, and we know these have consequences for people's lives. And I have not got up here, Chairman Cohilas has not got up here. We all know that on a different lane, financial assistance is coming from the federal government. But we're addressing this problem here in Albany, in Dougherty County, but we want to encourage those people who are suffering economic hardship to look for the resources to obtain information, because I am optimistic that with this stimulus package that was just passed, some of this hardship will be mitigated. Thank you.
How hard is it? Our decision is bankrupting people right now. Lines of the department, people are lining up to get checks from the Department of Labor. People are going without work. People are getting laid off every single day. We're telling people that they can't go to their loved ones' funerals. So how hard is it? It's hard, but these are the tough decisions that we were elected to make. And we're responsible for making those decisions irrespective of whether or not the governor decides to step in or the president decides to step in. Our job is to execute our sworn duty as the mayor and the chairman to make decisions, to declare a local state of emergency. And the back and forth you heard Mayor Dura talk about, like, those are some of the real things we wrestled with. Like, which businesses are we going to put out of business? Which business owners are we going to bankrupt? And those are hard decisions. Those aren't the types of decisions that you make by flipping a coin. Those are the decisions that you make in a task force, and you talk about, and you work through, and you get policy advice from the business community. You call different business people. You also talk to the people from the CDC, the Department of Public Health. You talk to the state officials, and then you make those decisions. And what we do, we have a responsibility to act no matter what either the governor chooses to do or chooses not to do, whether the president chooses to do something or not to do something. And what we have done and what we have chosen to do in Dougherty County is take swift, decisive, and precise action.
Do we have a member from the CDC here?
We do not. We do not. Okay. Thank you.
I did have one final question.
Yes.
I just wanted to ask, were there any plans of opening up Phoebe North and using that as a resource to accept COVID-19 patients?
What I'd like to do is, we do not have a Phoebe representative here to address that, so I would encourage you to reach out to Phoebe for that insight. Any other additional questions? Well, I'd like to, again, thank you for being here today. Thank everyone for participating in the press conference today. You can, of course, view the press conferences at 1 p.m. every day via Facebook Live, Channel 16, or any of the city or county websites, and certainly we thank you for covering it live today. We will see you tomorrow at 1 p.m.